Welcome to another edition of this Genome program. Today we are in discussion with the Honorable Dr. George Norton, Minister of Public Health. Minister, thank you very much for taking some time to sit with us.
Thank you very much.
We would just like to have an update, but first you said there are some breaking news you want to give us.
Yes, um, some years ago, right in Parliament here, Mr. Granger moved the motion for an investigation, a commission of inquiry into deaths in the Northwest District, particularly the Port Kaituma area, of children dying from gastroenteritis. Um, for some reason or the other, there had been a closing off of the media in terms of providing the public with information about that situation. Um, we want to do it different. We want to be the first to let the media know that we are on top of the situation that is existing not in Port Kaituma now, but in the village of Baramita. Baramita is manned by a social healthcare worker, a medics, and a doctor. We had one death so far on the 27th of last month, a child, but generally the symptoms that persons are presenting is that of diarrhea, vomiting, general weakness, and we had at one stage as much as 60 such persons. We do have it under control. We have enough medication there, but Baramita is situated in such a way that there are pockets or satellite villages away from the actual hospital, and it can be a real challenge to get to those areas because you can only travel there by the ATV vehicle. And I have been there. I know what it is. It really is a daunting affair. The other situation is we find that the population is not cooperating. They don't want to use the bleach in the water or the tablets that we're using in the water because they said it tastes bad. Secondly, they're not carrying through with the medications we're giving them to use, and they are not all attending to the clinics, even though the clinics are there available for them. So we're running into some difficulties there, but the situation has improved to what it was from the beginning.
Minister, do you anticipate it getting even more serious at this point?
We were on the verge of sending in a team, but the last message we had from that village against it because they said they have it under control. I don't think it will get worse because already we're seeing lots of improvement.
On another issue, Minister, can you give us an update on the H1N1 virus?
I'm glad that you're giving me this opportunity because media houses have been asking what it is that we're doing to inform the public with regards to what to expect, where do we stand, what is the status of that situation in the country. While we might be falling back, or there should be a kind, let's say, a lack in terms of brochures and handouts and handbills and so on, informing the public about what to do, what not to do, what to expect. The media has been behind this virus, and I can tell you that we depended so much on the both the private and the public media. They have interviewed me and other doctors practically on a daily basis. So by that, we know that we're getting out to the public there. That is not to tell us that we should not go using posters and so on. Unfortunately, there was a patient who traveled to Guyana, a Guyanese from China through the United States and Trinidad to Guyana, and was thought to have the symptoms, was hospitalized in a private institution. Subsequently, the relatives took him abroad for treatment. By that time, we had already taken off samples and sent it over to CARFA for testing. The results came back positive. We, however, did not waste time. We had immediately started dealing with the healthcare workers who were attending to this patient as well as their relatives. And so far, no one has come down with the signs or symptoms of that particular viral infection. There is a tablet that we use and we have it available. There's also a vaccine. I must tell you that right now, Trinidad is out and has a shortage of that tablet, and they're asking us to help them out with the first line of attack. And because we have sufficient, we have agreed to help out Trinidad in that particular aspect. Now, with respect to the vaccine, it is not a vaccine that is done routinely. These influenza-like vaccines are done occasionally in times of crisis, and we have not reached that stage where we would go and give the vaccination to everyone. However, not so long ago, Guyana has on record vaccinated 120,000 Guyanese using that same vaccine. So if it becomes necessary, we will do so. But so far, there's no need for that. But we are on the lookout. Our port health officers are fully aware. They are there present at the Timeri International Airport and the Ogle International Airport, along with the Molson Creek crossing, the Lethem Bridge, as well as at Charity. But of course, we've got a porous border. The water is low in the Takatu River and the Earring River, and people are literally walking across those rivers in all the different parts of the Rupununi, like for instance in Achiweb and places like that. Also in Region 8, in the Kanapang, Itabak area, you have persons who cross that river just walking across. So we do have some difficulties there. I'm particularly worried about the Brazil area because while we might not be having that scare of the H1N1 virus there, we have the Zika virus in Brazil. And I must let you know that while the Zika virus is not as debilitating, it's not so painful like that of the other virus we have. It has a very, very what I might refer to as a devastating effect on mothers that are pregnant because it causes neurological malformation of the babies. They're born with microcephalus, that is, the head is smaller than normal, and other neurological signs. But so far, there again, we have not detected any such virus here in Guyana.
Minister, I take it that the Ministry of Public Health is actively pursuing preventative measures for all of these viruses that we're taking note of.
We certainly are, and we've been living with dengue for the longest while, but we were on ball for the chikungunya. Persons know exactly what they had to do, and even though Ebola did not reach Guyana per se, we had our international health regulation focal point person right here, and we were in a position where we could have known beforehand that a person who was exposed to a country that had the Ebola virus would have been traveling to Guyana, and we keep them on the surveillance. They were monitored, and if, for instance, that patient needed to or came down with the symptoms, we would have been able to quarantine that person. We have the personnel, the technical personnel on board. We have the protective gears that is necessary in order to treat such persons. And I can tell you, if we had it under control for Ebola, we will have it under control for the other viruses as well.
Thank you. Minister, if I may shift your attention or focus a little bit, let's talk about the suicide and the suicide rate, all that's going on. I know for some time there was a suicide prevention committee that's under the purview of the Ministry of Public Health. Can you give us an update if this committee is functioning and what it was really doing at the moment?
But actually, suicide, for some reason or the other, is that albatross around the neck of the nation. Because, and I say the nation, because suicide is not only within the purview of the Ministry of Public Health. While we will not shirk our responsibility, while we want to play that important part, it's multifaceted. We've got social protection has got to come on board, social security has got to come on board, the NGOs, the faith-based organizations, you know, Ministry of Education, all has got to come on board because suicide is a big problem. What happened today with that, has happened just a few days before, and we know where we stand in terms of rating in the world. So we set up what is known as a national a suicide prevention national strategy. We have that just being controlled, particularly under the mental health strategy with a mental health committee. We're working towards that. Some might say that um, most suicides or a lot of suicides are not mental cases, but what the experts are telling us is that the problem lies in the society, and the solution itself also lies in the society. So we find that we've been able to take the bulls by the horn, for instance, in that same little village of Barmeter, where they were having as much as one suicide every 6 weeks for a prolonged period of time. This is a Carib village way on the Venezuelan border there, but they had that amount of suicide rate taking place. Things have changed dramatically because we sent in different teams. We even bring the school children out to Georgetown, and we have regular communication. Things are much different than it used to be before. And all in all, we find that while we might be getting an upper hand in that respect, yet we see the copycat syndrome happening here, where for some reason or the other, one is going to drive down from Kanji, cross all the bridges just to reach the Ogo, to board an airplane, paying all that money to go to Kaichur to plunge. And that was the third person to do that. So you find persons of all walks of life, persons who are managers, who are wealthy, who have good professions, they all fall victim to suicide. It is a problem, and I must say that we had a kind of a stakeholders meeting even today with the president, and this is important for the nation to understand that the president is leading by example. He called in us, all who were involved, for us to get on board and to do what is necessary, including education, social welfare, indigenous affairs, public health. We were there trying to come up with something that we can correct.
That's good. If we are to talk a little bit about infant mortality, Minister, I know this is a major area of focus, and you have said quite a lot about this having assumed office. Can you just give us an update on what's going on
I
at
am
your
still disappointed. I don't want to ever say that we came and meet this situation, because it worries me while we were out of office, like I am in office, and even much more so now that I'm in office. I've been a physician for 20 years, 30 years. Maternal mortality, infant mortality, in most cases can be avoided. A lot of it points to negligence, and this is something that is worrying us. It's worrying us because one maternal death is one too many. I've said it before. We have a system in place where investigations are being made and sanctions are taken. I somehow believe that we must improve on this. It cannot be business as usual for a doctor that is found to be negligent and cause, whether it's morbidity or mortality of a patient. And we've got to either, do more training, do more supervision, get more experts on board. But here again, I must commend the president. on the Sunday after Boxing Day, we had another emergency meeting because the president made a statement saying that I want to be able to announce that maternal mortality rate is zero. Now, regardless of whether that's impossible or not because of the different complications, that is the kind of attitude we, as a government, as a caring government, must adopt. And we've already started looking around to see what we can do in the short term. We know that the doubling up of mothers on the beds at the Georgetown Public Hospital is a sore point. It is something that we do not want to even witness. It exists still. We went to Leonora Hospital, the cottage hospital there. We saw a maternity section that is totally abandoned in spite of the good beds and mattresses and well structured. That we're going to bring back in place. We also went down to Diamond to find out what the situation is. The fact that we're extending that maternity unit to add another 50 beds with about 20 incubator unit and so on. The fact that we're improving on Bartica, West Dem, and Saudi Hospital to improve the primary health care. We're looking at New Amsterdam. We're trying to get more gynecologists and obstetricians in our system. We are still worried. We have a far way to go, and we're working towards that.
Minister, and finally, if I may, can you give us an idea of what we can expect coming from the Ministry of Public Health in this year, this new year, 2016?
Well, I must say that in terms of infrastructure, we are hoping that Port Kaituma Hospital, that is being built now, would be finished, functioning, and the residents in Region 1 will have, I don't like use the term state of the art, but will have a hospital so much better than they had before. Likewise, we hope that as early as in March, we will finish that extension of the maternal section of the Georgetown Public Hospital. We hope to see the cardiac center of the Georgetown Public Hospital functioning with one of the most modern equipment referred to as the cath lab. It's a hybrid system, and where persons who reach the Georgetown Hospital with a cardiac problem that requires surgery could go and enjoy that surgery free of cost. It is almost complete. The equipment is there, inserted. It is just a question of time before we start getting into that. Public-private partnership is the way we are going. We're expecting to see more imaging facilities available, CAT scan, MRIs, different studies for X-rays and so on. We are going to have that, along with, of course, our concentration on getting visiting teams to come and do surgeries here in Guyana that we had to take them abroad. Baby heart surgery is a success story where on every trip, 20, 21 babies are operated on, and for the heart, that would allow them to live a perfect life. But it's not only the operation that is done, it's the follow-up that those doctors are coming back to do, and most of it is done on a voluntary scale. We're looking to get more of that involved. We have reorganized our vector control area where malaria, where neglected tropical diseases, filaria, and so on is going to be dealt with in a more organized and systematic manner. Tuberculosis, we know tuberculosis is on the rise. We have a unit there that is functioning and would improve. Our HIV/AIDS, we're hoping if we can get to that 90-90-90 target of having 90% of all persons tested to know their status. 90% of those tested and are positive are on antiviral treatment, and that 90% of those on treatment are having the positive effect or suppression. So that if we can achieve that by 2020, we know that by 2030 we can eliminate HIV/AIDS out of the world. That is our aim and goal for the public health.
Minister, thank you very much and good luck.
Thanks
Thank
a
you.
lot.